Every minute of every day, somewhere in the world, and most often in a developing country, a woman dies of complications related to pregnancy or childbirth. India's maternal mortality ratio is 301. That is, one woman dies every 7 minutes. Safe motherhood means ensuring that all women receive the care they need to be safe and healthy throughout pregnancy and childbirth. You are not alone in this. Am I pregnant? This is a common question for those who are trying to conceive, and for those who are concerned about experiencing an unplanned pregnancy. You may be experiencing some symptoms and wonder if they could be signs of pregnancy. It can be difficult to determine whether or not your symptoms are related to pregnancy. These are abdominal pain, constipation, diarrhea, vomiting, flatulence, bloated stomach, loose appetite, burping, heartburn, acidic taste in mouth, squeamish, growling stomach. You are going to have a baby. Congratulations! Pregnancy is such a beautiful and intricate part of life. Conception typically occurs about 2 weeks after your last period begins. Estimate your due date. Add 7 days to the first day of your last period and subtract 3 months. A normal pregnancy is considered 280 days or 40 weeks. There are 3 development stages during 9 long months that we label as trimesters. Each trimester comes with its own unique changes and symptoms. Let's see inside the first trimester of pregnancy that will open a new chapter in your life and will even change the way you perceive things, especially if it is your first child. Baby's progress in the first 3 months. 4 weeks. Baby's brain and spinal cord have begun to form. Also, the heart, arms, and leg buds appear. The baby is now an embryo and 1/25 inches long. 8 weeks. All major organs and external body structures have begun to form. Baby's heart beats with regular rhythm. The eyes have moved forward on the face and eyelids have formed. 12 weeks. The nerve and muscle have worked together and baby can make a fist. The external sex organs show if the baby is a boy or girl. Head growth has slowed and baby is much longer at about 3 inches long. Changes to your body. A missed period. Implantation bleeding or cramping. White vaginal secretion. Frequent urination. Morning sickness. Dizziness. Nausea, vomiting. Food aversions or craving. Increased sensitivity to smell. Tender swollen breasts. Darkening of your areolas. Fatigue and mood changes. Heartburn or constipation. Warning symptoms to pay attention. A constant thirst of water that can't be sated. Abdominal pain that is unbearable. Pain while urinating. Heavy bleeding in the vagina. Problem with your vision or dizziness. Fever above 101 Fahrenheit with chills and muscle aches. 5 important foods you should work into your diet. Dark leafy greens, loaded with vitamins and nutrients and good for health of mother and baby. Greek yogurt, great source of protein and calcium. Salmon, low saturated fat and best source of omega-3 fatty acids. Eggs, good source of protein and a rich source of choline, a vitamin instrumental for the baby's brain growth. Water facilitates the absorption of essential nutrients into the cells and transports vitamins and minerals to the blood cells and to your baby. Care schedule. Prior to pregnancy or as soon as you find out, find an obstetrics and gynecology. Start a healthy eating plan with prenatal vitamins. Establish the due date with certainty. Weeks 4 to 8. Have a blood test to determine if you are cystic fibrosis carrier. Have first prenatal checkup 8 to 11 weeks. Weeks 9 to 13. Set an obstetrics and gynecology appointment to obtain fetal heart tones. Get nuchal translucency screening test (NTS) for Down syndrome and other chromosome abnormalities. Based on results of the NTS, decide whether to do a CVS diagnostic test. Highlight: pregnant women need to eat no more than 300 additional calories per day. So, eat right and take care of yourself in the first trimester in order to avoid any complication in coming trimesters of pregnancy. Next, we will discuss all about the second trimester. So till then, have a happy and safe motherhood. Please visit www.indiamedicalhub.com and share this video to help create awareness.